first guest is going to be Dr. Krista Lauer. Dr. Lauer is the medical director of the Lice Clinics of America. So, Dr. Lauer, welcome to the program.
Thank you so much, Dr. Whitlow. It's a pleasure to be with you.
So, I think probably a lot of our listeners, if they have small children, probably know a lot about lice anyway. But just for everybody, and we're going to talk specifically this evening about head lice because there's body lice and things like that. But we're going to focus, I think, mainly tonight on head lice. But what are lice?
So lice are a parasite, and there are three particular species that affect humans, as you mentioned. Head lice is the one that our clinics deal with. There's also body lice and lice that affects the genital area and eyelashes. But they are a parasite that feed on blood and live on different parts of the human body.
Mm-hmm. And how would somebody know that they have lice?
Well, that's a really interesting question because a lot of people who actually have lice don't know that they have it. And by the time somebody's identified with lice, it's often the case that they've had the parasite on them for 4 to 6 weeks before they start to exhibit any symptoms,
mm-hmm.
itching of the scalp, scratching, a tickling feeling on their head. So, by that time, there's been plenty of opportunity for the infestation to spread.
I see. And so, but those would be the kind of symptoms you would have. You'd have the sort of the itching, irritation, that kind of thing of the scalp?
Yes. Yeah, people develop sort of an allergic reaction to the bite itself, to the saliva of the lice when they bite. And so the allergic reaction takes a while to develop if you've never been exposed before,
mm-hmm.
about 4 to 6 weeks. So itching, if you see a child scratching their scalp or their hair a lot, particularly behind the ears or at the nape of the neck.
Mm-hmm.
Those tend to be favorite places. A lot of, if you're noticing that your child has some opened sores on
mm-hmm.
their scalp, that would be another clue that would make you want to take a closer look.
And so when somebody comes in, clearly in my practice, which is mainly an adult practice, although I do see children too, when I see itching in the scalp, I tend to think of seborrheic dermatitis, which is, like a form of dandruff. And how would you know in a child, is dandruff less common? And so when you see this itching, you sort of have a higher on your list that they may have lice? Or how do you go about making the diagnosis when a child comes in, or a mother or a father brings a child in with an itchy scalp?
Right. So, again, you're right. There are many different causes of an itchy scalp. Seborrheic dermatitis is certainly a common one. However, when you see a child scratching their scalp, you really want to be proactive and make sure that they don't have a lice infestation. And the best way to do that is as a parent, you can examine the scalp, or the school nurse can examine the hair, and you're looking for. It's unusual to find actual live lice. They're more difficult to identify. They're very small, 2 to 3 millimeters, about the size of a sesame seed.
Mm-hmm.
And they tend to be sort of beigeish brown, so they blend and they move quickly, so they're hard to find. The nits, which are the eggs that the adult female lays, she cements those to the shaft of the hair right at the scalp. So you're looking for something that's sort of tan or beige colored, and it's attached to the hair itself so firmly that if you take your fingers and you try and pinch to slide it along the hair shaft, it doesn't want to move.
Mm-hmm.
Unlike some other things like hair product, if a child's using a lot of gel or something in their hair,
mm-hmm.
they might get little globs of it on their hair, but you can slide those off easily.
Mm-hmm.
The best way to have it identified is actually use a professional lice comb. This comb has very, very narrow teeth. They're less than 1 millimeter apart, 0.2 millimeters actually. And you comb through the hair, and if you pull out these little nits or the eggs or the egg casings, then you know that there's the potential for an infestation.
I see. And is there a way, can you look at these nits, these eggs, to know whether these are, I guess we'll get into this in terms of treatment, but is there a way of knowing whether these are sort of old egg sacs and there's no more lice on the scalp versus are these, egg sacs that are potentially going to hatch? Can you tell the difference between an empty and a fertile egg sac from looking at it in any way?
It's really difficult. Certainly when the lice do hatch, the casings become white. Mm-hmm. So they're easier to identify an old eggshell, if you will, than one that's still got a louse in it, mm-hmm. That's developing. But the location is also important because lice they need to feed on the scalp. Mm-hmm. So they live near the hair line, right where the hair comes out of the scalp. And so if you see a nit that is more than a quarter inch away from the scalp, it's unlikely that is still a viable nit. There's been too much growth there. But the short answer is no. It's very difficult to tell. To
tell the difference.
Yes.
And if somebody wanted to buy one of these lice combs, can you get those in most drugstores, or do you have to order them online? How can somebody get one of these special sort of fine-tooth lice combs?
I believe that they're available in drugstores. However, in order to do the full comb out, one of the things that you can do is go to one of the clinics and have them do the head check for you, the comb out, and see if they pull any nits. However, I do believe they're available at pharmacies.
I see. And where would they go? I mean, obviously, you are the head of this Lice Clinic of America, which I believe is out in Utah. Do you have other branches in other places, or are there particular places a family or a person would go to deal with somebody who professionally, combs these lice or nits out?
Right. Well, so yes, Lice Clinics of America is a network of independently owned lice treatment clinics, and they do more than just the comb out for identification. They have a full treatment, which we'll get into later. But mm-hmm. There are more than 115 treatment locations across the U.S. It's the largest network of independently owned lice treatment clinics, mm-hmm. and between those clinics, they have successfully treated hundreds of thousands of lice infestations. Mm-hmm. We also have some international clinics as well, Australia, the UK, Europe. So,
okay,
yeah.
So you're around. Well, we have a call here from Miranda in California. Miranda, welcome to the program.
Hi, I have kind of a crazy question. I really fought this problem for a long time, and I have to tell you, it was the most horrible, horrific experience I've had with my little girl. But now we seem to have some eye irritation problem. I used the lid and the Nix problem several times, and I don't know if that is just going to be a residual kind of thing, but we went to see her physician, and the physician didn't think it was related, but it broke out during that time, and it continues. Her eyes water a lot. Have you ever heard of eye irritation from over-the-counter products?
But these are products that you've used at some point in the past. You haven't used them recently.
No, we used them like a month ago because we were trying to get rid of this. She got it during the Christmas holiday, and it took me all the way until almost the end of January to get rid of it.
I understand. So it's been like a month or so since you've used them, and she's had some residual eye irritation with tearing and such. All right, Dr. Lauer, do you want to weigh in on that one?
Sure. The unfortunate thing with the over-the-counter treatments now is they used to be, 30 years ago, they used to be highly effective. However, the lice have been around for, thousands of years, and they're smart, and they have developed resistance. So they have evolved or mutated to become resistant to the over-the-counter products. So the problem is what happened to you, Miranda, and I'm sorry for what you've gone through because it's so frustrating and time-consuming and irritating, not to mention, time from work and school and all of those things that are the direct fallout. But people continue to use these over-the-counter products, which are less and less effective, and therefore the potential for side effects increases. Remember, children have a larger body surface area than adults, so we're putting these pesticides onto their skin. There's the potential for absorption, and certainly they can cause skin irritation. I'm not sure about persistent eye watering that long after the use. That might be something that you want to have checked, but certainly there's the potential for skin irritation, systemic absorption into the system, that kind of thing.
Okay, that's helpful. I appreciate it. So what you're saying, though, about what you do, you're not going to use those chemicals plus your other methodology? I'm not quite clear on that.
Right. So I guess, Dr. Whitlow, is it okay if I get into
the
process?
we're jumping a little ahead of ourselves because we were talking about the diagnosis, but the next step really is no, it's not a problem. It's good. The next step is really, okay, so you got it. What do you do about it? So what do we have? I mean, we talked about the comb to go through the hair, but what kinds of medications can we use, either over the counter or prescription, to try to actually kill the lice?
Right. So there are different options. Certainly a comb will be effective if you are unbelievably patient. Your child is incredibly patient and cooperative, and you are persistent, because if you leave just 2 little nits in there and they hatch, and then the entire infestation can continue. So you need to be really persistent and thorough, and that's extremely difficult. It's just hard to get every single nit out, but that is a possibility. There are over-the-counter treatments. Miranda alluded to a couple, Rid and Nix, and they used to be highly effective. They are chemicals, neurotoxins actually, and they used to work at killing the lice. However, the media has coined this term super lice, which is the name for the evolved mutated resistant lice that I talked about a little bit earlier. And these lice have now developed resistance to those topical products. So you end up in this vicious cycle, like Miranda did, where you continue to apply these products and get more and more frustrated and spend more and more money out of pocket, wondering why it's not working. And that's because in 48 of the states that were included in a recent study that was in the Journal of Medical Entomology, these pesticide-resistant super lice are present. And so that's the frustrating part. There are prescriptions that are available. Unfortunately, they are stronger medications. They're more effective. They are more effective than the over-the-counters, but they also come with more potential side effects, contraindications with regard to the age that you can use them, potential side effects. One of them has a potential link to ADHD. One is potentially carcinogenic. You can't use certain ones if you're breastfeeding or if you have kidney or liver disease. So there's just a number of different issues aside from price that come with the over-the-counter, with the prescription medications that are available but are likely to be effective. And that's where the Lice Clinics of America comes in.
I see. Okay, because that's all you do. But in general, I would think that pediatricians and or dermatologists would probably treat a number of these infestations. People would go for that. But you require a prescription to do it. And should somebody go to either a lice clinic or their local pediatrician or dermatologist right away when they suspect it, or is it reasonable to try the over-the-counter medications first just to see if it'll work?
At this point, where the super lice are located in 48 of the states that were tested, which is all of the states that were tested,
right.
I think, and the over-the-counter products in some places are now only 25% effective.
Right.
So people are spending their money, taking their time. getting more and more frustrated. Some schools have no live lice policies. Some have no nit policies. So even if there are any eggs attached and no lice that have been found, kids can't go to school. That means parents are out of work. So I really think that it's probably reasonable at this stage with the development of the super lice to be checked.
I see. To be seen by a professional then.
Yeah.
Okay. All right. Okay. Does that help you, Miranda?
Yeah, that helped. I wish I heard this program before I went through all of this.
I'm sure you did.
Yeah, thank you. And it was called Lice Clinics of
Yes, if you go to www.liceclinicsofamerica.com, you'll be able to find a clinic near you, Miranda, and I will get into our really revolutionary technology for managing a lice infestation, which does not involve any pesticides and it uses an FDA-cleared medical device which blows heated, controlled air, but I'll get into that in a little more detail later.
So
stay tuned.
Thank
stay
you
tuned.
so much for the information.
Sure.
Okay, thank you for your call, Miranda. This is the Dermatology Show here on Dr. Radio. I'm Dr. Michael Whitlow, and I'm on the line with Dr. Krista Lauer, and we're talking about head lice. We have a call here, and actually, if you're out there with a question, please give us a call at 1-877-NYU-DOCS. That's 1-877-698-3627. We have a call here from Angela in Michigan. Angela, go ahead.
Hello.
Yes, go ahead, Angela.
Hi. I'm African American, and my daughter is mixed race. My husband is white. I've never had head lice or anyone in my family, and I've always heard that black people didn't get head lice because of the way lice have evolved in this country. First of all, I wanted to know if that was true, and second of all, what kind of steps would I take if she does ever have lice? Because I have no experience in this because, like I said, no one I know has had this issue before, and I don't wash her hair in the same way as, like, non-black people would wash their hair. I mean, because it takes me 3 hours to wash it in flat iron. So when I'm not washing it every day, like my husband washes his hair. So there are different issues going on, and I'd like to get some guidance.
Okay, Dr. Lauer?
Sure. So first of all, yes, African American people can get head lice. Now, because of the texture of the hair, in this country, Caucasian people tend to get head lice more than African Americans, but certainly anybody can get head lice. That's the answer to the first part of your question, Angela. The second part of the question brings up a really interesting point because head lice is completely an opportunistic parasite. That means that they don't discriminate in any way. Having a lice infestation has nothing to do with cleanliness or hygiene or your socioeconomic status. It's just purely head-to-head contact is the most common way. The lice just has the opportunity to transfer from one head to the other. And so that's why there's 6 to 12 million cases of lice infestation every year in the United States, usually in children because they play in close proximity, they're taking selfies with their heads together. Interestingly, sometimes some people believe that lice find it more difficult to maneuver through hair that is clean, that is not clean. So having more clean hair makes it more conducive for the lice to be able to maneuver. It's one of those things that just happens. So certainly the fact that you wash your daughter's hair in a different way is in no way contributing to the fact that she has or has not had lice.
Okay.
Okay.
Well, thank you. I appreciate that information.
Okay.
Of course. Yeah, good luck. You're very lucky to have never had it with those numbers.
Good job. All right. We have a call here from Sherry in California. Sherry, welcome to the program. Sherry? Hi.
Yes, can you hear me?
Yes, absolutely.
I'm calling as an African American whose daughter did get lice, and did hear that African American kids didn't get it, and my daughter probably had 2.5 feet of hair when she contracted it. We broke 3 of the little combs trying to drag it
Right.
in her hair
Yeah.
in order to get them. And so what we ended up finally doing, and she cried and she screamed and she wasn't very happy about it, is I went and got the biggest jar I could find and just saturated her hair with it, tied it up with a plastic bag, and she wore it all weekend, and that killed them.
That's interesting. That's fortunate. I have had friends who have done the same, and it didn't work quite as well. But that's excellent that it worked for you. It's unfortunate that you didn't know about Lice Clinics of America, because that could have saved all of the tears and the trauma. And it's just such a difficult problem for people. But yes, African Americans, as you found out, can get it. Dragging that lice comb through thick or textured hair is extremely difficult. As I said, it takes unbelievable patience, cooperation from the child, and then you have to make sure that you get every single nit. And so that's why our approach with Lice Clinics of America, with the FDA-cleared medical device, the heated air, and then a comb out, and then a topical treatment is guaranteed to work. I wish you'd known about us before you went through that.
Okay, well, it's good that it worked. Are there, Dr. Lauer, are there other occlusive techniques? I mean, mayonnaise obviously is very occlusive. Is it just a matter of depriving them of oxygen or immobilizing them so they can't get down and suck the blood? Are other occlusive, I mean, I guess you could even use Vaseline or something. Is that an effective, or can it be an effective modality? And what other things have people used?
Well, see, this is one of the concerning things about head lice. Head lice is not dangerous, right? Head lice can't transmit disease. It's a nuisance. It's a bother. It's socially devastating. But people resort to really extreme measures to try and get rid of it. I mean, it's one of the few non-dangerous entities where people have been killed trying to get rid of it, dumping gasoline or kerosene on their head, soaking their clothes. So that you have to take that into consideration. It's such a devastating problem socially for people and emotionally that they do resort to shaving heads, putting mayonnaise on their kids' heads and making them wear a bathing cap for a weekend, that kind of thing. Lice do have many breathing ports, and so you would need to completely saturate and block every single one of those for a prolonged period of time, because even like swimming doesn't work, showering doesn't work. Lice can live underwater for hours, so you would need to do it for a very prolonged period of time.
I see. Okay, well, so let's talk a little bit about the technique that you've been alluding to that you use at the Lice Clinics of America.
Sure. So Lice Clinics of America uses an FDA-cleared medical device that was developed by a professor at the University of Utah. And what this device does, we use a 3-step process. The first step of that is using this FDA-cleared medical device. It's called the Air-Lay. And what it does is it blows air at a very narrow temperature range and a specific temperature at a specific flow rate in a certain direction for a specific amount of time. And over 10 years of study, Dr. Dale Clayton, who is the inventor of the Air-Lay device, found that by directing the airflow at the scalp with all of those things, that he could dehydrate both the live lice and, more importantly, he could dehydrate and kill 99.2% of the eggs or the nits. Mm-hmm. And that's the big problem. Those nits are stuck on there. And if you leave just a few, you're back in the cycle.
Right.
So the first step of the Lice Clinics of America approach is to use this FDA-cleared medical device to dehydrate and kill the lice and the nits. The second part then is a comb out, and that's just to remove all of the dead debris, because some schools still have no nit policies. So if a child goes back and has a couple of nits that the school nurse sees, they're sent home. That's a completely separate topic, and there's been no proof that sending kids home actually reduces the infestation or the likelihood of it to spread. But that being said, you want to clear out all of the dead debris, the dead lice, the nits that have been killed with the Air-Lay device.
I see.
And then the final step is treatment with a post-treatment topical rinse, which they keep on for 10 minutes, and then they wash out at home. And that's just sort of the icing on the cake to make sure that everything has been eradicated. And using this procedure, we will give you a 100% guarantee that you are lice-free when you leave.
I see. Okay. Well, good. Okay, yeah. Sherry. So did that help answer your question about the mayonnaise there, Sherry?
It actually did. And I have grand twins now, and they're having an outbreak currently to their daycare. So I'll make sure I pass the information along that there's a method, a process that's out there to get right.
And you don't have to use all of your household condiments, and it's a single treatment, and you're free and clear.
All right,
very good. 100% guaranteed. So
okay, Sherry, thank you for your call. So let's talk a little bit about how contagious is this? You talked a little bit about schools kind of banning children if they have nits in the scalp and things like that. How contagious is this? And if I guess the second part of that question would be if a parent has a child where somebody in the school has been diagnosed with head lice, are there prophylactic things they can put on the scalp to try to reduce the possibility of transmission?
Yeah, so as far as how contagious it is, it really is a parasite that looks for the opportunity to transfer. And that's why children are so much more likely to get it than adults, although once a child brings it into a house, there's a 50% chance that another family member in the house is going to get it, usually the mom or an older sibling. So once it's in your house, then it sort of tends to take hold. But it's really the most common way that the parasite is transferred is head-to-head contact. So children playing together, a sleepover where they're sharing a pillow and their heads are touching, leaning over somebody, taking selfies with your heads pressed together. All of those things, the lice are looking for the opportunity to transfer from one head to another head. It is possible, although very rare, that you can get lice from inanimate objects like a brush or a hat or something like that. It's possible, somebody would have to have a heavy infestation. They would have to take the hat off and put it on somebody else's head, because lice can only live, they don't fly, they don't jump, they can only live a very short amount of time off the human head. So they dehydrate very quickly, and then then they're not able to, infect.
Right.
So we would recommend don't share brushes, don't share combs, just because it could happen. Don't share hats. But most importantly, when you're playing or when you're interacting with others, don't put your head against somebody else's head. Also, for girls or young boys that have longer hair, tying the hair up, pulling it back so it's not hanging loose, less opportunity to sort of swing and touch somebody else's hair, it will help to reduce the risk of transmission.
I see. And again, is there anything that can be done prophylactically other than just having the infected person, pull the hair back?
Right. So if you get that dreaded note from school and you're concerned that possibly your child has been exposed, then what you want to do is either check the head yourself, or if you're unsure that you can do it, have it checked by a professional. And then depending on the level of infestation, whether you need any treatment or not, there are different options that are available. The Lice Clinics of America does have a topical rinse, And if somebody, is very concerned, they could just do the topical rinse and then go home and wash it out.
I see. Okay. All right. Well, that's going to do it for us in this half hour. But I'd like to thank Dr. Krista Lauer for joining us from the Lice Clinics of America and helping to educate us about lice, how to diagnose us, and what we can do about it.